Hello, 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 Facebook. I am Dr. Myla Bennett of Diastasis Plastic Surgery and Medical Spa in Johns Creek, Georgia. And I'm coming on tonight to talk a little bit about liposuction and skin shrinkage. So I'm going to give people just a few minutes to come on with me. And for those of you who got on quick, y'all coming on quick tonight. Share the video, share. Hey, Tracy. Hey, Ambria, Tiana, Shantae. Hello. Hi, Sherry. Hi, Sean. Hi, Shantae. Thanks for coming on with me. Hi, Stephanie. Share the video, everybody. I guess this is something people want to hear about because folks are jumping on pretty quick today. And I almost didn't do it because I'm sleepy, but I was like, just do it. Just do it, Myla. Get on there and do it. I have a few liposuction openings for October, so I thought I'd talk a little bit more about lipo, and maybe we can get those couple spots filled. I got just a couple spots. So if somebody's thinking about lipo and ready to pull the trigger, now's the time. If you want it still in October, I have a couple dates in October still open. So, hi Melody, hi Francis, hi Brandy, Sheila, Jessica. Nope, I haven't started yet. I'm just getting on. Hi Juliet, hi Shonda, Brittany. Oh, hi Tressa, it's your first time? Welcome. Hi Valera, is that how you pronounce it? Valera? Dolly. Oh, good. Thanks, Dolly, for tagging somebody. You can also share the video. Okay, some creeper is in my messenger sending me inappropriate DMs. Like, why do guys do that? I'm married, y'all. For the men who are on here just watching, I'm married. Don't DM me. You might get a response back from my husband. Hi, Allison. Hi, Jessica. Thanks for sharing, y'all. Okay, so let's get started because I'm not staying on late. I say that every time and it still ends up being an hour. Aw, Angela, you can catch the replay, girl. But pulling over is safe. I don't want you to be trying to watch the video while you're driving. But you can listen. You can listen and drive. I'm like the radio, too. I have a few people who are like, I listen to you on my way to work in the morning. Like, they don't stay up late for my lives because they're already asleep. But then they watch me in the morning. They listen to me in the morning while they're driving into work. I was like, that's so neat. That made me think about maybe I should start a podcast. I don't know. Yes, I do tummy tucks, Wells Taylor. Absolutely, I do tummy tucks. I have I did a throwback Thursday this past Thursday, so a few days ago, of some of my favorite cases, and it's one or two tummy tucks in there. But if you go to my Instagram page, you can see much more as far as before and afters. The Adira Instagram page has more than the Dr. Myla one does. But yes, I absolutely do tummy tucks. I love tummy tucks. So if you're interested in a tummy tuck, I'm your girl. Thank you, Kia. Okay, so the topic tonight was how much will your skin shrink after liposuction? And the answer to that question is it varies from person to person. So, oh, Wells, I'm the doctor, boo. Where do you live? I do arm lipo and tummy tucks. Actually, in that photo album that I shared, like the Throwback Thursday pictures, I think I have an arm liposuction one in there, and one or two tummy tucks and some lipos. So check it out. Check out my post from Thursday. Oh, you live in Atlanta, girl. You sitting on my videos. I do great work. You need to just come to my office. Wells, I will look forward to hearing from you, sweet pea, so I can help you. So anyway, the answer to the question is it varies from person to person. And it also varies based on the type of liposuction that you get. So I have gotten some really dramatic outcomes from a skin shrinkage standpoint from liposuction. And I am a little more conservative with my tummy tucks compared to the average plastic surgeon because I have gotten such awesome results with liposuction. Hi, Gigi. I think that depending on what you have going on, people will come in sometimes with a tummy tuck consultation, and then I will educate them, show them, what I can accomplish with liposuction. And sometimes they end up with lipo only. The skin, whether or not the skin shrinks, is a few variables that have to be considered to determine your likelihood of the skin shrinking. First of all is whether or not you have stretch marks, and then if you do have stretch marks, if they're deep stretch marks or superficial ones. Some people have stretch marks that it's just like, it's almost just like a shadow of color change, but then you can tell that the stretch marks aren't ropey and they're not very, very deep. People who have those kind of shallow stretch marks, their skin tends to shrink still pretty well. So if they don't have a lot of hanging skin and it's just a little bit loose, and it's not crepey, then that's a person that I think it's better to do liposuction and try to get them happy with liposuction to help them avoid the incisions that come with the tummy tuck. And I've had really wonderful results with that. Ladies who thought they would need a tummy tuck and I did liposuction on them and they were elated and wearing bikinis. So the other thing, other than the stretch mark thing that is really important, some people don't have any stretch marks, but they still have really loose skin, so that the skin is very lax. And if you have really lax skin, you totally are going to have the skin cut away in order to make things tight. If you just get liposuction, it'll most likely still be lax. So I've had people who actually had pretty good skin tone, but superficial stretch marks, and those people may have a higher likelihood of the skin shrinking than a person with no stretch marks and really lax skin. So it's really not, it's not very cut and dry. So I kind of have to see stuff. No, Sweet Pea, it wouldn't be over $15,000 for tummy tuck and arm lipo. I'm not mad. It won't be more than $15,000 for that. Not for a tummy tuck and arm lipo. Nope. You need to call me, girl. Let me give you my website. www.adarabella.com. Well, send your contact information to my website, and I will have my peoples call you tomorrow or email you tomorrow, whichever you prefer. But no, it won't be more than $15,000 for that. So it's really weird. I have to see the skin in order to be able to give you my best educated guess on whether or not your skin will shrink. If you don't have any stretch marks and you don't have nothing's hanging, nothing's loose, and your skin tone is good, then the skin's going to shrink. That's kind of a no-brainer. And I've seen a lot of people post before and after pictures of women who had exactly that: great skin tone, no stretch marks, no hanging skin, and they gave them a tummy tuck. And I'm like, what the heck did they put those scars on that person's belly for? It's so not necessary. People get tummy tucks way more than they need to get them. Yay! Yay, Gigi, I'm ready too, girl. Yes, I can, Allie, I can fix a messed up high scar. I've done that a few times for people who came in who had tummy tucks from other people before and the incisions were super high. They can be lowered. Yes. You should also hit my website up. I can help you with that. So really what you need to, what the variables that affect whether or not you're going to shrink is really skin tone, laxity, and the depth of stretch marks if you have them. Stretch marks themselves are not a deal breaker for liposuction. My BMI limit for liposuction is 33, and for tummy tucks is 35. Yes. 33 for lipo. Thank you, Rachel. For back rolls, yes, the skin will shrink as long as the skin on your back is not hanging. If you just have rolls and the skin is toned and it's not hanging and stretchy, then it will most likely shrink right on down. Yes. Healthy skin has a really amazing ability to shrink. My liposuction starts at $4,000. And it varies depending on the how many areas you get and how big you are in the midsection, which would determine how long it'll take. So that makes the price vary. So I'm just looking back for questions. Oh, good question, Deanne Barnes. So she said, for lipo only, is it for people who haven't had multiple kids and need a muscle repair? So if a person if a person has a minor diastasis, actually sometimes the liposuction, the scarring that happens after liposuction internally, combined with the compression, will hold the diastasis together and almost kind of repair it. It's like the scar forms like a glue. If you have a really wide diastasis, that won't work. So it depends. I will have to examine you to see if I think you got a shot at being able to make your stomach go flat even if you have a diastasis, but it will be a small diastasis. If you have a big diastasis, that's not going to work. You have to get it closed. I do not take care credit, but I do accept Alpheon, Lending USA, and United Medical Credit, and I also have like a program in my office if your credit's not good, where you can pay towards your surgery, pay like it's almost like layaway. It's almost like a surgery layaway plan. So if you're interested in something like that, give my office a call and they can explain that policy to you. My number to the office is 678-325-0006. But I do not accept care credit. Oh, thank you, Shaylee. What if your BMI is low? Is there a safe way to get it up? How long do you have to wait to be able? I can't see the rest of your question, Nikki. If your BMI is low, that's not a problem. That's a good thing, right? As long as you're not anorexic. And if you're anorexic, you don't need lipo because you're anorexic. So a low BMI is a good thing. If you just have a low BMI and trouble areas, that's like the absolute perfect candidate for liposuction. Thank you, Tiana, for putting my phone number in there. Thank you. Tiana, you trying to be my assistant, girl? Yes, Wells, I saw your message, and I will get your information over to my staff. I'll actually send it over tonight. If she's awake, she'll probably email you tonight. If you've had multiple abdominal surgeries, no children will lipo make your stomach. If you haven't had any children, even with multiple, I can't see the whole comment, Carla, but if you haven't had any children, then you're probably definitely a candidate for liposuction. Allie, I don't give advice about pictures people inbox me unless I do a consult with them. So if you would like to do a consultation, inbox me your phone number and your email address, and then my staff will call you and get you on my schedule and give you the best way to send pictures. But I won't comment on pictures of people that I am not consulting with. The BBL and fat transfer varies. They start at $11,000 in my office, but the price varies based on how many areas you need liposuction on. Thank you, Kimberly. Kimberly, you must be a veteran, girl. You on here like, ladies, she doesn't quote prices without an in-person consultation. Doesn't have to be in person. I do virtual consultations as well for people who are out of town, because I actually have a lot of out-of-town clients. I would say half or more of my patient base is from out of town. So I definitely do virtual consultations for people. I am in Johns Creek, Wells. Thank you, Tamara Tipton. Thanks, y'all. Hi, Shamika. Thanks for jumping on. Is it safe to get a tummy tuck lipo with a BMI of 37? Okay, I won't say it's not safe. I would say that your likelihood of being happy with your result is lower, Complications are higher. The complication rate is higher the higher your BMI, which is why I have a BMI cutoff. But also satisfaction rate goes down as your BMI goes up. So for liposuction, generally speaking, the people that I've done liposuction on when I would do it back in the day with those higher BMIs like 37, they were never happy. I would work my heart out, be sweating like a pig, sucking out all this fat, and they would be like, I don't look no different. I'm like, but I took out 5 liters. So that's part of the reason why I require a BMI to be lower, because I have no desire to do all that work and you not be happy. And a lot of times the places the person is trying to get to from a visual standpoint, if their BMI is higher, one round of lipo won't get it. And lipo isn't cheap. So it's just better from a satisfaction standpoint for your BMI to be lower. But from when you're getting tummy tucks, your complication rate is higher the higher your BMI. And the complications that are the most concerning or the most likely to happen when your BMI is higher is the wound opening up, so a breakdown of the incision. Yes, I do apply the consultation fee toward the surgery. I don't apply consultation fees toward skin services and stuff like that. So people with tummy tucks, when they have a high BMI, they have a higher risk of the incision opening up, a higher risk of infection, more blood loss. So the lower your BMI, the better. A virtual consultation, just call and set up a consultation with my office. They will have you send pictures. We'll give you the information on how to send the pictures, and then we can talk via video, or we can talk over the phone, whatever you prefer. Stretch marks on my stomach from pregnancy. Do I need a tummy tuck or can I still get lipo? Madeline, it depends on your stretch marks. So if there's superficial stretch marks, and you don't have hanging skin and your skin's not crepey, then you may be able to just get lipo. No, Deanna, actually, if you want surgery in February, this is not too early. This is the right time to do it, to make sure you can get the date you want. February is a very popular month, so if you want February, you actually should do your consultation now. Yeah. I'm not sure if J Plasma is coming. I'm still trying to figure that out. I perform lipo both ways, under local and under general. If your BMI is 33, between 30 and 33, you have to be put to sleep. If your BMI is under 30, I'll do it under local. I'm willing to do it under local. If you want it, if your BMI is under 30 and you want to be put to sleep, you still can be put to sleep. My consultation fee is $150, and I do the consultation. It's not with someone else, it's with me. Yes, I do body lifts. There's a fee for all consults. It doesn't matter. It's $150 whether you come into my office or we do it virtually, because it's still my time and, it's still me. It's all me. So no consultation is free in my office. If your belly looks like a walnut shell, then that's like such a good analogy. When you said that, I literally envisioned it. So if that's what you have going on, you need a tummy tuck. A liposuction alone won't work. Kelly Rogers asked if I recommend losing weight before a tummy tuck. And I do if you are trying to lose a lot of weight. So I recommend you be within 10 to 15 pounds of your goal weight. My baby girl's acting like she's going to wake up. I must be talking too loud. I recommend you be within 10 to 15 pounds of your goal weight before you get your tummy tuck. If you get the tummy tuck and then go lose 30 pounds, then you won't be pulled tight anymore. I had weight loss surgery and need extended tummy tuck. Are you willing to do a BBL also? I'm so flat. Yes, but I wouldn't do the tummy tuck and the BBL at the same time if our donor site for the BBL is your belly. Oh, Tamara, you said your tummy is a walnut shell too. Yeah, that means if you have a walnut shell, then you need a tummy tuck, and we can make it nice and smooth, like a pecan shell. Yeah, I do my own consultations. You meet me, I see you, I touch you, I come up with a plan. It's not a sales consultant. It's me, and that's why I don't do them for free, because it's my time. What do you tell your patients are must-haves after a tummy tuck? What do you mean must-haves? Gabby, yes. School was hard. Not so much college. Well, college was hard. Actually, college was hard. But I would say my residency was harder. A BBL, Tamia, is short for Brazilian butt lift, which is liposuctioning fat and then transferring it to your butt to make your butt bigger. Tiana, you said you want to wear a crop top before you're called home to the Lord. Girl, I can help you. My preference is if your BMI is above 30 to go to surgery, to the OR. And if your BMI is under 30, as long as you're not like an anxious, nervous Nelly, then I like doing it with people awake. But if you're nervous, if you have a really anxious personality type, I'd rather you be asleep. Like, I like it both ways, so. I don't recommend doctors, darling, Nikki. I don't do these videos to go and endorse other doctors, sweetheart. But the information I give makes it so that you can make a safe decision for yourself, but I'm not going to tell you to go to somebody else. While they're sleeping in their bed and I'm up on these videos teaching, I'm not going to send you to another person. That's not really fair to ask me to do that. Nothing's wrong with using the belly fat. It's just not safe to use the belly fat at the same time. Like, it's not safe to do liposuction. It's not safe to do liposuction on your belly at the same time as a tummy tuck. A lot of surgeons do it, but the complications are so much higher. And when you see ladies saying that they have necrosis, or you see the pictures of necrosis, 9 times out of 10, those ladies had a tummy tuck and liposuction on their abdomen at the exact same time. It makes it so much riskier. So I personally don't do it. I don't do cosmetic surgery on people with a BMI over 40. Your BMI has to be at least 35 or lower for a tummy tuck and under 33 for liposuction. Amanda, I don't really understand your question. I don't know what you mean, like, must-haves for a tummy tuck recovery. Are you talking about products, or like, I don't really understand what you mean, sweetie. The flanks are included in my prices for what, a tummy tuck? Like, you don't get liposuction with your tummy tuck out the gate. That's an additional cost. But it's not that much extra to get liposuction to your size if you're getting a tummy tuck. Yes, the umbilical hernia can be fixed, Allie. Is recovery for lipo asleep or awake the same time and follows? It's a little bit... Oh, okay, Amanda. All right, hold on one second. It's a little bit... I would say the recovery is a little bit slightly longer when you're put to sleep, but it's just like a couple of days difference. When you're not put to sleep for liposuction, literally I tell people you just need 48 hours and you can go back to your business as usual. You can go back to work in 2 or 3 days after liposuction if you're not put to sleep. Now, if you're put to sleep, it still may be 2 or 3 days, but it all depends on how fast your body metabolizes the anesthesia. So some people, they may be groggy or just not feel quite themselves for up to a week after general anesthesia. But if you don't get general anesthesia and you get liposuction, you could legit go back to work in 3 days. The amount of lipo I can do while doing a tummy tuck is not, like, I won't do any lipo on the abdomen when I do a tummy tuck, but I'll lipo the person's sides or their back or their arms or their thighs. Yes, I do lipo 360 awake all the time, Laura. Okay, and so as far as recovery for after a tummy tuck, I have my patients, I don't do a lot of that stuff that a lot of these ladies do. What I do recommend is sleeping in a recliner if you have one. sleeping in a recliner for like that first week after a tummy tuck is the easiest way for people to be able to get rest, since you're not able to stand up straight right after the tummy tuck. And so if you can't stand up straight, that means you also can't lay flat. But if you can't get a recliner, sleeping with your head up on like 3 or 4 pillows, and then having 3 or 4 pillows under your legs to keep your body folded, you can get by with that. And then I just put them in an abdominal binder. I don't have them like in a faja right after the tummy tuck. Usually I won't put them in that until the drains come out. And really that's it. Like, my patients after a tummy tuck, they don't have any bandages or dressings to change. The only thing you got to do is take care of your drains, which is just empty them out once a day and record the output. And really that's it. It's not a lot. Yes, the complications are much higher when as your BMI goes up, Tamia. You can return to work in like 3 days or so after lipo 360, Char. A tummy tuck, you need about 2 weeks off work. Lipo 360 is lipo of the abdomen, sides, and back. I usually do, honestly, I do no more than 2 people a day when I do surgery. 4 weeks after a BBL, you're sitting on those thigh pillows. For lipo 360, it's your abdomen, your sides, and your back from your bra strap down on your back. I don't use the pain pump for tummy tucks. I don't like them. All right, y'all were firing those questions off tonight. I guess y'all like talking about lipo, huh? Well, as I said, I have 2 spots left for October. So if somebody wants those, put your phone number, name, and email in my DM, and I'll have my staff contact you. If you want a tummy tuck, I don't know if I'll be able to get that in October, but you still might be able to get in November and maybe December for a tummy tuck. What areas can you remove fat from for a good transfer? I like to use the torso. So the abdomen, sides, and back, I like to use for fat transfer. Yep. Necrosis is common because everybody's getting lipo and tummy tucks at the same time. You do not want to do that. Like, it's playing Russian roulette. You don't know. It's a really high chance that something's going to die if you do liposuction of your central abdomen and a tummy tuck at the same time. And I don't like complications. I have 0 necrosis rate. 0. I have not had 1 cosmetic patient ever get necrosis. Not 1. 0. And I also have a 0 seroma rate for liposuction. And I maybe have had 2 seromas from tummy tucks, which was years ago. I haven't had one of those recently either, in years. Like, I'm super conservative, and I just don't like complications. So everything I can do to avoid them, I do it. So if I see a procedure has a high rate of a particular complication that I hate, I don't do it. I won't do that combination. Yes, I consider the number of sites when pricing for lipo. Usually I space the lipo and tummy tuck out by 3 months. Yes, lymphatic massage after liposuction is key. I don't do a lot of BBL, so I actually don't have any BBL pictures up. I don't post pictures of BBLs because I'm not really trying to grow my BBL practice. If somebody wants a BBL, I'll do it, but that's not something that I market. I think I might have 1 BBL on my website to show you that I don't do those. I think it's 1 BBL before and after picture on my website. And I don't do those really big ones. I make a person who has like no butt look normal. I don't do like the super tiny waist with the big hips that caricature type. I don't do that kind. I don't really care for that. What if you already had a tummy tuck and then get a BBL with that fat dye? No, that's okay. That fat will be fine. Yes, my gluteal contouring. I love doing that. That helps make your butt look bigger. When people think they don't have a butt and they really do have one hidden under there, and I just kind of carve it out. Yeah, like the extreme hourglass look, no, but a realistic hourglass look, yes. Like if you want to be super tiny waist and big hips, I'm not the person. But if you just, if you want your, your waistline to go in and you have nice natural curvature, then I do that. But I don't do those really extreme ones. I don't do consults on Saturdays. I'm open, for business Monday through Friday. Thank you, sweetheart. Gigi, I use medical grade skincare, and I do hydrofacials on my face. Yes, I do that. Right, Wells Taylor. That's right. I do that. I do hydrofacials. I do vampire facials, and I do this other treatment called the intensive, which is a combination of microneedling and radio frequency on my face. And I'm going to do a chemical peel when I get back. I'm going to a plastic surgery meeting this weekend. And when I come back from that, I'm doing a chemical peel. I do chemical peels on my face twice a year. Gluteal contouring is not part of 360. And the price difference depends on how much contouring you need. So you would have to get a consult, me look at you to tell you that. Yeah, I don't do the Nicki Minaj. Nicole Murphy's body is on point. I need to find out who her plastic surgeon was so they can do my plastic surgery. Because I need to get my midsection together since I'm done having kids. Yes, Nicole Murphy's figure is all that. Hey, Holly, congratulations on your weight loss. Thank you, Shaylee. Hydrofacials once a month is perfect. On my Instagram, on Adarabella's Instagram, I actually did a Insta live today doing a hydrofacial on a guy. Oh wow, Holly, you had to have 2 revisions? With weight loss patients, it's a little tougher, and that's not unheard of. Yeah, that's right. So with people who lose a lot of weight, like the skin will get loose again, for sure. That if you lose a lot of weight, like for massive weight loss patients, that is something that totally happens. Yeah. Hi, Myla Domino Britt. I love your name. Yeah, that's not unheard of, Holly. All right, y'all. I'm about to roll out for tonight. After the second time it was perfect, good. Okay, so if you want to contact me and you want one of those 2 spots, then you can DM me your email and phone number and name, and I'll have my staff contact you tomorrow to get you a consult ASAP. And then, or you can reach out to my website at www.edarabella, EDERRABELLA.com. Or you can call my office at 678-325-0006. Hi, Rochelle. And what are the facials for hyperpigmentation? I did a video about that like last week. Go back through my past videos and look for the one where I was talking about hyperpigmentation. Hi, Tam. Oh, my God. Thank you for watching from Hampton, Virginia. You're welcome, everybody, for the information. I want you guys to have a great night. Also, if you haven't registered for my Peels and Prosecco event on October 6th, please do register. If you go to my website, you can, I think there's a pop-up to help you go and register for that event. And at that event, we'll be doing chemical peels, which also helps with hyperpigmentation, helps with acne scarring, it helps with texture. It helps with fine lines, helps with everything. We're doing chemical peels that day and having Prosecco, and I'll be offering specials on a lot of the medical spa services, including vaginal rejuvenation. So if that's something you all are interested in, register for the event. It's $50. You get $25 worth of product, and you also get a $25 credit towards your service. All right, everybody. I will check y'all later. Bye.